everyone. I am so excited to be doing this. My name is Reena Pande. I'm a physician and the former chief medical officer of Able2, a virtual behavioral health company. In my career, spanning multiple parts of the healthcare ecosystem over the last several decades, it's become very clear to me how important the role of the physician leader, the physician entrepreneur, the physician executive is in driving clinical innovation and ensuring healthy clinical outcomes and healthy business growth. So I'm excited to be launching this webcast, podcast series to shine the light on great clinician leaders, healthcare entrepreneurs that I have witnessed really finding that balance between their clinical expertise and business discipline. The first to join me on this series is a dear friend, former colleague, former investor, former partner, Minal Patel. I'm so excited to have Minal in one of my early sessions to highlight amazing clinician entrepreneurs. Take a listen. So, Minal, thank you so much for joining today. I'm thrilled. You are one of my first participants in this new webcast podcast series that I am initiating, focused on the healthcare executive, and specifically the healthcare executive with clinical expertise, like you and me, and those of us who've gone up through the ranks in medicine or other clinical disciplines, and have shifted gears to becoming an entrepreneur on the business side. And I think there's something so special in that, at that intersection of business and clinical disciplines. And I'm hoping to shine a light on people like you who have done an extraordinary job of blending those two disciplines, because I think it's so important for more people like you to be in leadership roles in healthcare innovation in order to drive new healthcare technology forward. So thank you so much for joining.
I am honored to be here, Reena. Thank you.
I appreciate it. We go way back, as you know, and I'm sure in our conversation, which no doubt will be freewheeling here, we will probably hit on some of the history going way back to our younger years. But so I'm thrilled to have you. So I'm just going to run your history quickly, and you add and or subtract if I miss anything. So currently CEO and founder of Abacus Insights. Before that, Chief Strategy Officer at Horizon. And before that, another stint at entrepreneurship, founding and running a company called Care Management International, which was acquired, correct me if I'm wrong, but by iHealth Technologies. A stint at Horizon before that, a stint at McKinsey before that, and way in the back, near and dear to my heart, trained at Brigham and Women's Hospital, where you were on staff as an internal medicine doc. So here's the question to start with for you. Someone who's new and entering this world as a clinician thinking about entrepreneurship or the business world might look at that history and go, wow, that's sort of Paul Farmer-esque. Like, it's so unicorn-like that how could I ever aspire to be like Minal? Do you think you're a unicorn in this way, or are there characteristics that you bring that you have carried through that others can try to emulate? What are those characteristics?
Yeah, so when I reflect on that journey, Reena, and then I look at people around me like you and so many others that either from the Brigham or other places have gone on to do some great things that were not just the traditional academic medicine path, which is, okay, I'm going to do my residency, fellowship, then join the faculty at some research organization, and then just grow my career. I look and say there's a lot of commonality. And I think the only difference in my path, one could argue, is that I went back into the corporate world, right? That I left the academic establishment, joined McKinsey and Company. But the goal at McKinsey wasn't to join the business world, to be honest. The goal there was really that while I was doing work at the Brigham, the typical academic, right? I had a research appointment in pharmacoepidemiology. I was doing a lot of hospitalist work and clinical work in then called DEMA, the primary care unit, attending on the general medicine service a couple of weeks, I think about a month a year. And then also a bunch of administrative work that I was doing for the hospital on quality improvement.
Okay.
And it was really that work that someone said, he's really good at this. And I got more and more of, advising the Pharmacy and Therapeutics Committee about what drugs should be on formulary and how they should be used in the inpatient setting. And so McKinsey was more of a, hey, you know what? Some of this work that I'm doing requires some things that I never learned, right? Project management, never learned how to do, an analysis, a financial analysis, read a pro forma. And so instead of going to business school, McKinsey was more of that sort of academic training, without having to pay for it, candidly, right? As that journey moved on, and McKinsey led to then my payer world, and I can come back to that, that path of academic medicine, residency, consulting into whatever business world it is not uncommon at all. The only uncommonality for me is that at some point after successfully exiting a company, and actually in there's a second company I started, which is minor in the whole
I don't think I even remember that one.
Yeah, well, it was because I wasn't ever intended to go back to Horizon. It was one of those things. I started the company, the phone call rang, and the chairman at the time had been my boss before, and said, "Would you come back and work for me?" And I said, "I just started a company." Well, he said, "You can't do both." And ultimately, I found a buyer for that company, like in a 6-month period. So it was one of those quick kind of deals. But it was that sort of returning back to the big corporate world where that was the anomaly, right? So to answer your question about, am I a unicorn or not? I don't think so. I think there's a lot of commonality in my pedigree, and both in terms of as an Indian immigrant, a child of two blue collar professionals, if you will, and that just had a different level of risk taking than someone that may not have been from that ilk, that ended up in this journey. With the one exception of going back to a large plan and leaving and doing it again. That's probably the only anomaly.
The back and forth, you're right, is different, right? To do entrepreneurship, the payer, entrepreneurship again, right? Is that back and forth. Take me back to the beginning. I'm sure there are a lot of folks listening who are in that early phase of their career, right? And back when you were at the Brigham, early, you're an early attending, and you start to dabble's not the right word. We start to have experiences in quality and safety and more administrative work. And if you can remember back, like what was going on in your brain back then that made you go, I got to go do something different? Like we certainly have colleagues, right, who have gone up the ranks within academia, and some who've gone back, who we've both worked with. But what made you go, I want to go to McKinsey. I need to do that training program and learn about all these other things I've not learned about.
I was never, kind of caught by any one organ system, right? So at the Brigham, either you love the heart or you loved working with cancer patients, or you're a pulmonologist. And coming in, people had that mindset of that's what I'm here to do. I was always that generalist. I'm coming to learn how to be a general internist. And then along the way, met people like David Bates, who was my GMS 1 or 2 attending as an intern. And then the whole patient safety world and the work he was doing at the time around clinical physician order entry, and then would go to talks by guys like Jerry Avorn, who would talk about how drugs are affecting the elderly, and so started to begin to think about that there's other things that I could do with my interests that could impact people potentially at a larger scale than that one patient at a time, which I absolutely loved and miss. But it was never about, hey, I'm going to be great at the heart or the kidney or the lung. And so I was somewhere in my second year at R2 where that kind of light bulb went off, where I'm like, I'm not going to specialize in any of the traditional fellowship tracks. But when I started learning about some of these other things that I could do in terms of, figuring out whether I could, do a general medicine fellowship, right? Or, thinking about Jerry Avorn, again, in the pharmacoepidemiology world, it was very clear. It's like, I don't have a fellowship track. I'll make you a junior attending, but you'll do the things that a fellow would do and learn and also pay for your master's in public health. And that felt like a great deal. So it felt like it wasn't going to pigeonhole me into one thing, but teach me a variety of things, still allow me to do the clinical work that I like to do, further credential me with an MPH that opened up both the clinical effectiveness program and a few other things that felt like the right path. And ultimately, that's really what the interim step was, right? And then, as I said earlier, to fund my salary, I never realized how this works, but I think someone's got to, they got to get the money somehow.
Somewhere,
it wasn't going to be the patient revenue or whatever HMS was going to pay for whatever lectures were going to be given, right? It turned out that Jerry had committed to the hospital. that his faculty would be advisors on a variety of things around how to use drugs in the inpatient setting, advising, particularly in the formulary area, high cost drugs, are we rationalizing it? And that really became the projects that I started getting really both interested in, excited about, and in retrospect, good at, right? And so that's when I think at some point the administration of the hospital realized, hey, this guy's good at this.
Yeah.
He's convincing physicians how to change their prescribing using academic research, and then putting them into decision trees and protocols. Some of the first pamphlets that we created that eventually became part of the Brigham kind of lore. We instituted called pizza rounds. Remember, on Fridays in the Eppinger conference room, pharmaceutical companies used to come and buy pizza. We said, cut that out. The pharmaceutical companies have a self-interest. We, as the pharmacoepidemiology department, we should pay for the pizza and come and talk about things that matter for good clinical care, cost-effective clinical care that residents otherwise would never get excited about or interested in or have access to, more importantly. And so that work was what generated the wow, there's a lot of opportunity here. But realizing that I was handicapped a little bit, not having that formal training, but couldn't stomach getting another degree after working on an MPH, an MD, a BA. Hence the McKinsey route as the sort of fellowship I didn't want to have to pay for. Right. So.
I get it. I love the history. It's interesting because you could have stayed and worked with Jerry Avorn and David Bates and persisted in sort of a more academic path. But made the decision at that point to get more business exposure, more consulting exposure, right? And to learn some of those things, minus the degree, right? I have the same sentiment. My dad used to ask me like, so are you going to go back and get an MBA once I left the Brigham and joined Able to? I'm like, I'm getting my training on the job here. I don't need school and I don't want to stop and pay for school, number one. But yeah, so here's a question for you. In that era, there probably weren't as many folks as there are today, right? Sort of with this inclination towards whether it's consulting or industry, as the term is sort of generally applied. Now there's the Brigham in particular has residents that go off and do an MBA at the same time that they're participating in their residency. Harvard has an MD MBA program, so on and so forth. Back then, right, how did you make the decision to do McKinsey, right, versus jumping out to a startup or just staying, right? I mean, there weren't as many role models back then. I'm curious to get your take on, you had your internal mentors, Jerry Avorn, David Bates, and others, but how did you start to see that there was a path outside of our academic world?
Yeah, it's hard to remember what the specifics were. And you're right. And there were a few people that had gone ahead and applied to McKinsey and done. But interestingly enough, one of them, Doug Martin, who he and I still remain friends after all these years, he laughs in hindsight. I'm the one who told him about this thing called McKinsey, and he went and applied and went. Right. And I waited and that's why. And I joined the faculty. And so there were a few of us at the time that were beginning that. McKinsey itself and BCG to some extent, Bain to some extent, were now investing in coming and looking for people like us, right, that were well trained, that had some level of analytical ability, presence, and the things that they screen you for. To really give them credibility as they're sitting in front of customers and their clients who are solving problems that require a level of clinical insight or knowledge in order to try to get their work done, right? So it's sort of a confluence of factors here. And for me, it wasn't like I had one mentor. I had a series of people that I looked at and said, boy, they do interesting things. Tom Lee, right? I remember bumping into him in the elevator one day where he was so excited. He'd come from a meeting where he heard about this thing called disease management, where giving patients better care at home and giving them scales and watching their fluids, and mechanizing and industrializing it would actually, improve lives and outcomes and save the system money. And he was so excited that 30-second elevator ride. I'm like, that's interesting. And I went and looked up and I'm like, wow, that's kind of cool. Troy Brennan, right? Troy Brennan was these are all like luminaries in the industry that I every day had interactions with, that would snippets here and conversations over here, around how to take care of patients, but do it in a very different mindset than the traditional. They come to the hospital, they see you, you admit them, you take care of them, they go home, and then, kind of somebody else So that kind of set the ground for it.
I forgot that you had like the Tom Lees and the Troy Brennans in your orbit in your
Yeah.
era, right? For me, you were in my orbit when you were already at McKinsey and coming back to serve as a hospitalist on the general medicine service. And, I had folks like Vivek Murthy was a co-resident of mine. And, we'd be on the wards kind of jamming about what kind of big picture things we, could do. He, of course, went on to be the Surgeon General, right? But yeah, I had forgotten that you had folks like that in your orbit when you were coming up, to see, to ideate with and to like plant these like kernels of thoughts that make you go,
Jim Kim and I were fellow
Mhm.
moonlighters in the short stay unit, right? And Jim Kim was like, and then
Right.
just look at his pedigree and what he.
Sure.
So I was privileged to be amongst both leaders and faculties and peers that were already thinking. Tom Lee, the other Tom Lee, had left to go to Hippocrates, and ultimately went on to do One
Right.
Medical
Right.
and et cetera. So
Great.
if people look and say Minal pioneered, there's absolutely not. I had a lot of people that both paved the way, or pieces of the way, and showed that path. But when I came back and said to folks, "Hey, I'm leaving to go to McKinsey and Company," whoa, there was a bit of a what happened,
Yeah,
like and
I know
um,
that sentiment, having felt it myself.
yeah, and there were some that were like, "Hey, go. We'll always be here." Some
Mhm.
were like, "Huh, interesting. You sure you don't want to stay a few more years, get a little bit more?" Because I was only on faculty for about 2.5 years,
Mhm.
hadn't really published much, and so there was
Right.
like, maybe you want to make a name first and then go do something. And so there was a lot of this debate,
Yeah.
and that's why I didn't talk to anybody about it until it was decided, until I'd accepted the offer, because I knew there'd
Oh,
be these
interesting.
antibodies coming at you,
Yeah.
right?
Right.
And it was
Right.
fait accompli at that point. So
Yeah, there's either disappointment or jealousy, but nothing in between. Like, half the people are like, how do I do that too? Right. And the others feel like the academic path is the only path, and you're made to feel a little guilty and by having picked another path. I mean, it's a great path. And I think I had to come to terms with that too. Was
well,
academia is fabulous if it's the right path for you. And if it's not, then go be fabulous somewhere else, right? And make your mark in healthcare in
Well,
a
there were
different
two
way.
there were two validating things for me, right? So from McKinsey, I went on to the payer world, and I can tell you what happened there and how that happened, I should
Yeah.
say.
Yeah.
But there were two things that happened that validated it. One was a interesting when I was at Horizon. The chief medical officer had said, "Let's go to Boston and spend a week at the intensive review of internal medicine. Like, I
Oh
want to
boy.
make sure that we're
Okay.
staying current." And so he paid for it. We
The
stayed at the
board review course you're talking about.
Yes, yes. And
Okay.
then the crazy thing was there were former residents of mine that were giving the talks. Like Anne LaCase was
Oh
doing the
yeah,
leukemia
yeah.
talk. I'm like, oh my God, like she was my intern, when I was in R2, right? And so,
I love it.
so it was a humbling experience. But I remember one of the nights they have a nice big dinner, and I sat next to Gene Braunwald.
Mhm.
And Dr. Braunwald leaned over and asked me, what is it that I'm doing as a Brigham alum? And when I told him I worked for Horizon Blue Cross Blue Shield of New Jersey, he said, "And what is your mission at Horizon?" And I said, "Dr.
Wow.
Brunwell, my mission as the head of quality is to make sure all of the great academic work that you and all of the people you've pioneered
Mhm.
and led forth, like beta blockers post MI and statins, for blah blah blah." And it's to make sure it actually happens. It gets reimbursed. He said,
Yeah,
"That is a mission that's quite worthy of
I
your
love
education."
it.
And that was number one.
You're
And
like, good.
two,
I got the
when Troy
thumbs up from
Brand
Eugene Brunwald.
and when Troy Brennan left to go to Aetna, I was like, "Ding, here
Yeah.
we go." So it was validating the people that I
Yeah.
really trusted, respected, and Brumwell is like, an icon, as you
Yeah.
know, and that gave you that confidence that you're doing good work, right?
Yeah.
Your mission, why you came here, your North Star is still consistently your North Star, which is a really, really important point in terms of why and how I think successful physicians in
Yeah.
leadership will continue to be successful as long as that North Star, whatever it is for them, does not go away. Right. So
Let's dig in there, because actually it's a fabulous point, right? And I think there are so many biases that exist, misperceptions about from physicians or clinicians more broadly about what it means to work at a payer or at a consulting firm or in the business world broadly. And I think one of those misconceptions is the ability to balance a North Star that's clinically oriented and the business needs of a business, right? Can you think about unit economics? Can you think about margin? And at the same time, ensure quality and evidence-based practices. So how have you thought about that? And what do you say to the naysayers, right, who say, clinicians can't do both? Because I certainly have heard that from folks.
Yeah, look, so as in anything, it depends what business you're in, right?
Mhm.
If you're in the business of, if the business you join is a business that inherently the way it makes its money is by people being less healthy.
Yeah,
And again, I'll say it: you're in the tobacco industry, you're in the alcohol industry, right? If those are the industries you join, man, I'd really scratch my head and ask the question of how the moral equivalency question can be answered. But there's so many incredible businesses where the mission of the business is consistent with what I went to school for, taking care of
sure.
patients at a much broader level that allows you, given how much opportunity in the system exists, right, to both improve health and do it cost effectively, and not cost. I didn't say reducing cost effectively. Even the
Yeah,
most expensive interventions are worth it if it actually improves the
exactly.
outcomes that we want. From that standpoint, there's so many incredible opportunities to do that. And candidly, as founders, right? I mean, again, I look at you as an extremely early, if not founding member of Able to. That's what excited you, right? Is that you're going to make people
100%.
better by doing what you do. And yes, there's money to be made along the way, but if that first thing isn't there, then the second thing doesn't matter. At least not to me on a personal level. And so that North Star that's the point
Yeah.
of not losing your way, right?
Yeah, I used to use that term North Star too for our company at Able to. It was, we I think stayed focused on that North Star from minute one, till the day we got acquired and beyond. Yeah, and people used to ask me this, like, how do you think about clinical quality and think about the business? But to me, they were one and the same. Like, if you can do good for patients and think about how to do right for the system, and think about cost, it's doable. But I think you're right. Like, you have to always keep that North Star in front of you as a guiding principle, for sure. Yeah.
I mean, what part of the reason why I left McKinsey is that,
Mm,
18 months into my journey, all I had done was consult for life science companies. And it was about growth strategy for product. It was about how do I get this company to be top 5 in the world, and involved M&A. And it was all about, making money. And again, I learned a ton. But I just wasn't satisfied with the work, right? And maybe one or two times I was like, "Ooh, this feels a bit unethical to me." And but it was always like,
mm,
great impact. Lots of the clients loved the work that I was doing. I got accolades. In fact, one
yeah.
of the people said to me, "You have an incredible career here." The day before I resigned, that was the conversation, and but because it wasn't fulfilling, right? And the work-life balance was a different issue altogether. But it just
Sure.
that North Star wasn't quite there. And I ended up at Horizon because actually I was in an engagement with Horizon, and it
Mhm.
wasn't intentional. It was okay. I'm going to do this work, and not life sciences. I would prefer it to be a hospital system, but that 4-month engagement that McKinsey had hired Horizon hired McKinsey for,
Great.
really got me to learn how mission driven the payers can be. A
Yeah.
profit Blue Cross plan. I was really impressed with. This was not about EPS, and it wasn't about earnings growth. It was about, hey, we've got a bunch of initiatives. How do we, yes, we have budgets and we have to save money for our employers,
Yeah.
but the entire quality initiative, an entire care management set of initiatives and safety initiatives. And so that's what got me out of into the payer world. And over the last 24 years, that's what I've been doing. Right. So
Yeah. Say more about the payer work, right? I've obviously interacted a ton with payers too, with you when you were at Horizon and at United, et cetera. So I certainly have my fair share of experiences, but I'd love your perspective from the inside, because I do think when I was in my clinical seat solely before I had exposure to the outside world, I did have some negative perceptions of payers. I mean, my only interaction with payers was when I was applying, I was trying to get a stress test for a patient, and I would get, a call about a prior approval, or, I had to negotiate with a utilization management doc, to get my test approved for my patient. So, but when I kind of opened up the black box and started to meet folks, I had the same sentiment, right? There are really good people who are trying to make a difference. Yeah, but I'd appreciate your perspective, having lived on the inside.
Yeah.
A lot of clinicians have misperceptions, and there are bad players out there, right? And there are folks who are financially motivated primarily. I get that too, but curious what you would say to folks who
Yeah.
are looking at payers.
Bottom line is the payer is hired to do one of the hardest jobs in our system right now. Clinical care is hard, and as a former practicing physician, that empathy and the work and the hard effort that people put in, but there's a validation that you get from that patient, that family, when things go well.
Mhm.
And even if when things don't go well, most of the time, patients, families understand, Doc, you did the best thing you could for me,
Yeah.
or the nurse, you did the best thing for me. And there's this genuine like goodness that you get, right? The payer's the exact opposite industry and business, where the payer's job is to manage resources and
Yeah.
often help make decisions or make decisions on resource allocation that when the system works well, nobody knows about, nobody cares about. No one's ever written to their payer
Yeah.
and said, thank you for approving my
Yeah, totally.
MRI.
You only interact with them when there's some issue, right?
Right.
Otherwise, it happens behind the scenes.
And when there's an issue, it's because more often than not, there is a genuine disagreement on when something should be done, whether it's on a benefit level, you
Mhm.
didn't purchase it, you're not authorized for it, or a clinical level. And the process is unfortunately not perfect enough to get to resolution quickly that creates that friction, right? So it's the exact opposite of the healthcare delivery world, where even in the worst circumstance, even when a patient dies, if the perception is you've done your best, the families, in the payer world, you're always sitting in a situation where the kitchen, the heat in the kitchen is really, really hot. Right now, I believe firmly that people like us belong in that kitchen to make sure that those decisions are still made for the right reasons with that North Star, not because, hey,
Yes.
the PS target or something we have to meet. But you've got to have the Constitution to look at your fellow physicians, fellow clinicians in the eye and say, no, we're not going to allow this to happen for these reasons. Okay, and so it's a really, really tough
Yeah.
business to be in. Part of my bias has been typically in the not-for-profit world. The Blues, in particular, are genuinely, they're community-minded. They're focused locally. They genuinely care about the physicians and hospital partners. It doesn't come away in the transactions.
Yeah.
Again, I've not worked for the for-profit world, so I can't say I have a different experience there. But most of my clients, and particularly Horizon and the Blues that I've been part of for all these years, mission matters, right?
Mhm.
Community matters, and the triple/quadruple aim matters. And those are things that again, give me hope that there are people that will do the right thing at the right time, and the system hopefully will continue to improve as time goes on.
Yeah, for sure. Let's switch gears a bit and talk about entrepreneurship, because we haven't really gotten into any of your company founding and building endeavors over the years. So you've started several companies over the years. I don't want people to think you're a unicorn, but there are some features of you that are really unique, right? That, Doc, McKinsey, payer, entrepreneur. But yeah, I mean, as a physician, leader and executive, talk to me about like the first idea that found, how
Yeah.
did you go from, I'm a consultant, right? Where you're sort of telling other people what they should do, hoping and praying that they actually take your advice, to being at the payer, right? And running, Horizon New York. And then, there's a thing I gotta go build. That's another challenge.
Yeah.
Actually take an idea and turn it into something real and meaningful.
So I had two stints in my first time at Horizon, right? So when I left McKinsey, my first role at Horizon was to be essentially I was the executive medical director for quality and clinical innovations.
Okay.
And what that meant was I basically had all of the NCQA, URAC,
Mhm.
HEDIS. Then disease management was just becoming something that was in vogue.
Right.
So if you had been at Able to when I was there, I would have been the buyer of the Able to service,
Interesting.
right? So it was all of those programs that were meant to offer services to our members, to keep them healthy, to make them healthy, hopefully so that there's a downstream impact to utilization and overall improvement in cost and outcome, right? That was the job. And man, for a guy, like what a dream job to
Right.
land in a payer that said, we're going to invest in this and we need you to go do it.
Right.
Man, that 2.5 years was
So
so
great.
much fun. Some of the best professional relationships. Some of the people still work with me today. They're
Yeah.
still with me
Right.
because it's
Right.
such a good time, particularly when you found those people that were in the organization or recruited them in that was so excited that said, this is cool. This matters, right? And we
Right.
moved the needle. Horizon went from average in the state to number one in every clinical
Right.
metric. Beta blocker post MI, breast cancer screening,
So
cervical cancer
great.
screening. And so it was just a fun job.
True to
Um,
your word with Eugene Brunwald, right? To say, I'm going to take all those data-driven learnings and find a way to implement them at scale.
at
And that's what
scale,
they are.
at that point, 3.5 million people in New Jersey, right? That to me was
It's very cool.
still a scale, right? I mean,
Yeah.
and I think the light bulb for my company came up is because, so believe it or not, Horizon gave me funding to go hire 100 nurses,
Okay.
right? To build out the care management, disease management programs across diabetes, cardiac conditions, a little bit of oncology. Oncology was very, very complicated for all the reasons that you appreciate. Behavioral health was always carved out separately, and
Yep.
you guys fixed that problem, thank goodness. But finding 100 nurses was hard, right? We would do trade shows, and 6 nurses would show up, and
Right.
that's when I said, why can't we do this from the Philippines or India? Spoke to McKinsey. I'm sorry, spoke to Cognizant, Infosys, Wipro.
Okay.
They came in with their PowerPoint decks, and when I said, how many nurses do you have today? They're like, none. We'll do a pilot with you. I'm like, not so sure, right?
I could do this myself. Thank you.
So the idea didn't come from Minal's a smart guy. The idea came from, man, I need help here, right?
Yeah.
And then I also said, do we need nurses? Can we de-skill, a right skill, I should say?
Or upskill other types, clinician types, right? To
Exactly right.
try
So,
to,
and medical directors, they're looking at all these documents. Can we get them to, get summaries so they can make decisions faster? So that became the view of how do we improve the process, reduce
Yeah.
our operating cost, improve speed to market, get better servicing for the provider partners, for members, et cetera. And no one could help me. All these big companies, great game, but I just couldn't take the risk on it. Then I got promoted to run Horizon New York, and that was a distraction, I would say. Someone else then took over this work. I went to run Horizon New York, and then learned, which was a great step for me, because up until that moment, I was the SME running a department.
Yeah.
Where I was the SME. I was the guy that understood
You knew
the criteria.
quality. Yeah.
Yeah. The only
Safety.
thing I didn't know was how to run an
How
operation.
to run the business. Yeah.
Right. Well, just or a piece of a business, right?
Mhm.
Horizon New York gave me how to run a business, not just
Mhm.
operations, but the sales and marketing, the negotiation of the contracts with the providers, the brokers, understanding that entire channel, the systems, the technology, and a lot of it we bought from our parent company. But now I'm responsible for the full P&L of this business, which was unfortunately not doing well marketplace, right? So a great early 30s to be the president of a
Great experience.
New York City. Great experience for me, right? And the ability, which was the biggest benefit, to learn how to work with, coach, recruit people that had skill sets that you knew nothing about,
Yeah.
like finance, network negotiation, technology and operations, sales and marketing. None
Yeah.
of those were my competencies. And so that was like, wow, okay, you're leading a team now of people that are way smarter than you in what they
Mhm.
do, and how to get them to work together. That was the learning that happened there, or the
Yeah.
beginnings, I would say, of the learning that happened there. And so when we decided we're exiting that market, Horizon came back and said, ironically, we'll give you the job of chief strategy officer. This is in 2006.
Oh, back then they offered you that job. I didn't know that.
I don't think so. I think I'm going to go try to build that company that I was looking for a couple of years ago.
Right. Right.
Still nobody had built it. So that's how we started CMI, right? It
Got
was
it.
that was the idea of CMI. It didn't come from, anything, but I was looking for it. And when I went around
Didn't
talking with,
exist in the market, and you're like, someone's got to solve this problem. Yeah. That is probably a repeatable skill. Not maybe learnable, but certainly something we were talking earlier about, like qualities that you see in others, right? This sense of there's a problem, it needs to get solved, and then you're willing to get out there and find a way, busting through brick walls to go solve it, right? Because you see the power of, finding a path forward.
And you have
I see
to,
that in other entrepreneurs.
feel passionate about it.
Yeah, totally. I want to go back to something you just said about leading a team of experts that were not in your particular area of expertise. So I think that's another thing, just going back to the theme of like clinicians finding their way in this world. We, as clinicians, we're often the ones who know everything in the room, certainly within the medical institutions, right? We're sort of the top of the chain in terms of the ones who know. And I think it takes a significant amount of humility to be in rooms with people who bring other expertise and to be open, know what you're good at, but then also to be open and willing to learn from other experts around you. So tell me more about that, because I certainly was similarly in positions where I'm, I don't really know anything about sales and marketing or finance or product, right? Product was absolutely, frankly was a new discipline to the world, but also new to me. And finding like that middle ground between those experts and my expertise was actually, I think, was the unlock for us at Able to not just me, but clinical and all these other disciplines, right? Finding our way to one another was when magic happened.
Well, so it's interesting. So I have a slightly different view as a non-specialist clinician.
Okay.
Where, I mean, I was often finding my cardiology friends to give me advice on a case, or calling the orthopedic surgeon, say, hey, I need you to look at this X-ray for me, or building the sort of coalition, or my nurses, right, who had way more insight as to what was happening, when times that I was not there. And so I think the, we're trained inherently to sort of stick to our knitting and leverage expertise when we need to, right? And the best clinicians that I know, knowing the difference is almost always the trick, right? To know when you need help and call for it, or sometimes even before you actually need it, call for it. So it's, so I think there's a training that we have inherently. And then secondly, I think, institutions like the Brigham, people always ask me, what's special about the Brigham? Like, why are there so many incredible entrepreneurs that are physicians coming out of this one institution? Because we have a mafia out there, right? And
it's
we were
impressive.
the early ones, but like if you look at, I was at a founder's breakfast that Alicorp hosted, and Brett Farduli, and which was just 5 years ago minted out of there, right? So very young, maybe 10 years ago. And so from my point of view, I think it's also because when I got to the Brigham, I was at BU for undergrad and med school, loved my time there. But graduated, almost at the top of my class. Real strong accolades from the department, all the departments of medicine, certainly the departments of medicine that I did all my rotations in. I got to the Brigham and I was like, oh, well, I'm not as smart as I thought, right? Because everyone
impressive character.
One of the first times in my life where I was like, wow, like and you brought your A game out. Yes, there were insecurities that came up, but you brought your A game out, and you really figure out, wow, this is a different level of just intellect and energy, and which is incredible. And so you get taught that, like in that period where at 2 a.m. Your interns, you're all interns. It doesn't matter where you came from, and you're all working together and trying to get through the night together, right? That there's something special about, and again, haven't trained anywhere else to know the difference, haven't worked anywhere else to know the difference. There's something unique about that gave you the humility. I think gave us the humility to say, yeah, I'm not a finance person, I'm not a product person, I'm not a tech person, and so I got a lot to learn about what it is you offer, so that we can come together to solve whatever it is that we're looking to solve. Right?
Yeah, I think it's so interesting. I hadn't thought of it that way at all. So it's great to hear your perspective. I mean, as an internist, because by default, you kind of have to take the expertise of the other clinical experts around you. But the Brigham environment was also unique to just be surrounded by insanely smart people. And you have to come with humility. You have to be confident in your own expertise and strengths, but then you also have to know that there's an incredible cohort of people around you, right? And it's the same, their lessons are the same. I did almost no one else I worked with at Able to had a sort of Harvard Brigham pedigree, but they brought an immense amount of skills and expertise and strengths that like I had to really learned to tap into, which was just so much fun.
If you gave truth serum to my Brigham peers in that area, right,
Yeah.
in that time frame, I'm sure they would tell you Manal was a really nice guy. He wasn't the smartest guy. Like, like there were a lot of times we did stupid things, and I remember what those
Yeah.
were, right?
I'm sure we all did.
Meaning there were some residents you looked at, like we were just in awe. They would just always have the
Yeah.
answer, always on their game. I wasn't one of those.
Yeah. Yeah.
I was not going to be chief. I knew that. Like I was not going to be asked to be chief resident, right?
Yeah.
And I was okay with it. Like it was like
Yeah. Right.
that's okay, right?
Exactly.
It wasn't like a oh boy, I'm dragging here, right? And interestingly enough, McKinsey was another experience like that. When I got to McKinsey, I was like, oh, this is in a different dimension, very different dimension, but
Right.
wow, like a different cohort of people that you realize had just a different energy and caliber that you. So that sort of set the table for the ability to not need to be the smartest person in the room, right?
Yeah.
Or maybe even not want to be the smartest person in the room, right? Because boy, there's a lot that you can do and get done around you when others are the ones that are facilitating and kind of growing together with you. So
Yeah, I love that. Yeah, I had to, there was points early in my entrepreneurial phase of my career that I thought, oh, I need to learn about project management and I need to learn about, this or that or the other thing, but quickly came to appreciate that there are people who are just gifted at this work. I'm gifted at certain things and I'm absolutely not gifted at others. And there's no point in me trying to be a medium quality, good at a thing when there are people who are experts, and we should just all bring our expertise and, cover our blind spots, if you will, with folks who have that level of expertise in the thing you don't do well. That's how personally, I think that's how we win as teams, versus trying to be everything all the time, right? I think that's
absolutely.
a recipe for disaster. Let me think about what else I want to ask you. I mean, you and I could talk forever and ever, but let me make sure there's a couple of things I wanted to cover. Talk to me about fundraising. You've gotten through a couple of rounds of founding companies,
Yep.
and more and more I'm seeing clinicians in the VC role, and few and far between, but still increasing in numbers, which is great. So folks who have got that perspective on the investor side, and increasing numbers of physician or clinician more broadly, founders or CEOs raising money. And, just curious what your experience has been.
Yeah.
Were there challenges? Were there advantages?
I would say I'm not sure if there's inherently challenge or advantage. I think it's fundamentally the same thing that any venture capitalist looks at, any investor looks at when they encounter someone who's got this idea, right? Is okay, is the idea credible or not? And if you're a clinician, it's a clinical idea, fine. Is there a business to be built is the point around it. And then the question is, does this person have the EQ to be able to know what he or she are going to need to succeed, and B, able to get those people to follow him or her, right?
Yeah.
If you've got a solid business plan and you can answer those questions and credibly the person on the side feels like, man, this person can do it, right? May not have done it before, but I can see how they can make it happen. That's it, right? And whether you're a doc or a lawyer or an engineer or a pharmacist, or it almost doesn't matter. I think there's maybe a little bit more of a hurdle as a doc that, and again, I think not so much anymore, but back then it was, can docs really lead? Can we be true? Can we be team players and business leaders? And I think we're through that gate. But I don't think anyone ever looked at me and said, "Oh, he's a doc. Why would he?" In fact, CMI wasn't a unique experience because, this is one where I ran the operation for 2.5 years at an at-scale pair, and this is the same stuff I needed to build. I just needed to have to do it in a different geography, but I was still the subject matter expert, right? I was still the guy that understood which medical policies, what kind of doctors we needed, I would interview the early docs. I interviewed them all. I spoke to them, understood, okay, they get it or they don't get it.
Right.
Right. So in that regard, the credibility of being a doctor was really helpful, given the product and the service was, right? Abacus is different, right? Abacus, man, tech, data, like Minal doesn't know how to turn a computer on. Like how the hell, and so can Minal hire the right CTO? Can Minal hire the right product people and the right, people that can help actually build it and ultimately, sell and scale the business. So, but
yeah, that's great. It's interesting because you had the management experience coming into entrepreneurship that I think a lot of folks don't necessarily have. So I do think that that early horizon stint probably set you up for greater success on
it
the
did.
the
The,
next go round, because that
the
is
only,
unique. And as docs, we don't
yeah,
otherwise get
the only
trained to be
question
managers.
The only question there, that did come up is, Horizon's a big company, right? You had, and even Horizon New York, you had the backing of a,
Yeah.
very large, established payer. And so, can you work in McKinsey's even bigger, and the Brigham's even bigger, right?
Can
Can
you
you?
do the 0 to 1 thing?
Yeah, that was
Mm,
the question. Now that got answered at CMI, right?
yeah.
So now after that, okay, you've got the ability to say, okay, I can do this, and kind of
Yeah,
bring it.
yeah. And if you have the other characteristics, a vision for what you're trying to build, the wherewithal and the EQ to be a leader and have people follow you against the idea, right? Someone had to just take a chance that you could do
Yeah,
this one thing, right? And you were able to convince them and prove them right. So, which is great. In our last couple of minutes, couple additional questions. So, the women always get this question about life
yeah,
balance. So I'm an equal opportunity, right? I'm gonna point some of these questions at you that we often get, which is, right, like here,
yeah.
I know you have a family and you're dedicated to all that happens outside of your day job. Tell me about life. Tell me about family, and
Yeah.
how you've had some challenging roles over the years. Like, how have you and
Yeah.
your family been able to balance?
So none of this is possible without an incredibly supportive spouse, right? For me, wife, right? And not just in terms of the sort of emotional support, but even financial. I mean, she's a phenomenally successful executive under her own right that gave
Yeah.
me a lot of ability to take risk. But I think the most important things, I remember when I came back and I had this idea for CMI and I had this job offer,
Right.
very well paid, in the mid 2000s, 35 years old, a really large salary that would have just, been a game changer for us. And I remember having a conversation with her to say, hey, when our first son was just born, Dylan was probably like 4 months old, 5 months old. And she said, I'd rather you come home 3 days a week energized by what you do than be home 7 days a week, frustrated that things aren't being done, because
Mm,
that's what our kids are going to see, right?
yeah,
And that was a really
it's
sort of
powerful.
insightful, supportive statement that said, you're right. Like if the time I'm around, if I'm not exuding passion and
Yeah,
confidence, and again, sometimes there's a mess. I mean, particularly in the entrepreneurial world, right? Days can be a disaster, but that real support really opened up the eyes. Let's go do this, and let's go do this together, right? And 20 plus years, like it's been a partnership,
right.
true partnership, where there have been times where I've had to travel like a madman. In her executive role, she's been traveling and was traveling a lot pre-pandemic, and a lot of that's stabilized. But I think that without that, I've been blessed. I don't know
Yeah.
how I could do it otherwise. And then the other thing I would say is that I've also, when you talk about priorities in your life, right? Husband, father, physician, right? In that order is always how I've thought about it. So even when someone asked me way, way back, look, what do you want to be when you grow up? I would say the best husband, the best dad, and the best doctor. And in that order, meaning if being the best dad means I can't practice medicine anymore, I'm going to give it up. And that's exactly what happened. I
Right.
couldn't do that. And I tell my kids, if being a better husband is I got to get rid of one of you, I'm going to get rid of one of you, right? There's just a strict hierarchy in how the world works. And it's helped because even when I sold my first company, the buyer, Doug Williams, we have so much respect for, he asked me, he said, you've never had a boss in the last 8 years. What do I need to know about you? I said, Doug, I said, if you can protect 3 hours of my day, I'll give you the other 21. And I said, give me 7 to 8 in the morning and 6 to 8 in the evening. 7, 8 in the morning, I'm walking my kids to the school bus, giving them breakfast, and 6 to 8 in the evening, we're doing homework, taking baths and putting them to bed. You'll meet at 9 o'clock, 10 o'clock, 1 o'clock, no problem. And he did it. Right.
Right.
And so that is the kind of discipline of saying, I'm going to turn my computer off. I'm focusing on my kids. I've got them
Yeah.
for this limited amount of time. and make it happen, is actually paid off really, really well for us. And so I think if you ask my kids, they'd say, yeah, Papa kind of works hard, but he's around.
Yeah.
Um, One of them thinks I'm lazy, but put that aside,
Yeah, no, ignore him. He doesn't know what he's talking about. I love it. I
So,
love that. I think, yes, so many people forget to at least be cognizant of their priorities. And, I would say the same, but the priorities that you had, but I won't lie. I mean, I think there were times when I was so focused on work, traveling a ton that, able to became priority number one and family number two, right? And that required a reset and a
yeah,
reevaluation of priorities. And oh, wait, like what really matters to me? Well, my husband and my kids matter the most, and I wouldn't even be over here if it weren't for the
absolutely.
support that I have in my spouse. So I echo everything you said, and I think it's easy sometimes to get off track, and it just requires a constant review and reevaluation. Right? Where am I in my life, and what am I prioritizing?
And the ask is, as a leader, is to then really instill that in your teams, right?
Yeah.
And not, and set the example where, I'm the one who says I'm not available. I'm with my family, or I've got this funeral I have to go to,
Yeah.
cancel my meetings. And that sets the tone for everybody else
Yeah.
around you to just say, well, I can now do that too. And then it just creates this culture where, interestingly, people work harder, right?
Yes.
Because they're appreciated. They know that when they need you, you're going to be there for them. So when you need them, they're going to be there for you. And that's paid off in dividends in almost all of
100%.
the businesses I've worked with.
Yeah, I agree. I should put it on my calendar, even if it was just a mental health day, I would put it on my calendar so people, you teach by example in those ways. So, well, in the last few minutes, I'll turn it to you and to say, is there something I haven't, I mean, we could talk about a trillion things. Is there anything I haven't asked you that you would want to share? Maybe a piece of
Yeah,
advice to the next generation of clinician healthcare leaders coming up?
I would say the one thing we didn't talk about, which was the hardest thing for me in the sort of professional domain, it took me a while to figure this out. But as a physician, we are trained, as physicians, we are trained inherently when someone's in front of you with and interacting with you, it's because they need your help. And the objective of why they're there is usually clear, and the dominance of the conversation, I don't mean that from a power perspective, but the ability to manage that conversation is relatively clear, right?
Yeah.
In the business world, it's not.
Mm,
And the hard part is the leap to understand that people have agendas, and to be thoughtful and almost about what's not said in a room versus what is said in a room, and being intentional about creating that insight. That is something I think as physicians we are inherently not trained for.
yeah.
And so it took me very practically, my team will not allow me to interview any candidate until it's the last possible
We've
person.
already vetted this person. We just need your kind of final okay, because we can't
Right.
just
Because I like everybody, and
trust your judge of character.
I want to like everybody.
I'm like that too. I
Right,
will find the good in people.
right.
I will find it.
And
It's there. That is my principle. Others
and
feel
when
like
you're
everybody's
seeing,
evil, but I feel like there's good in everybody.
so I'm the closer. I'm the one they bring at the end. Now, when I say, "Boy, is something wrong with this?" But they're like, "Whoa, man, I'll
Yeah.
actually think something's wrong." So, but that's
Yeah.
you have to understand that that is a blind spot and be cognizant of it, right?
Yeah.
But that's, I think, a part of its personality, but part of that's our training, right?
Yeah.
Someone's in front of you, the trend, that relationship is set, the norms are set. In the business world, every context, sometimes someone's in the room with you, it's a different context than if they're by yourself, and it's different if they called you before the meeting than versus after the meeting, before the contract signed versus, these are all things that are really important. That's a soft skill, that needs to be a hard skill, that
Yeah.
if you think about putting a course together, that's a good one to think
Mhm.
about. Right? So
Yeah. And some of that is experience,
yeah,
right? Some of the hard knocks of having perceived an interaction in one way and then coming to learn that agenda was
but
different
at a
than
minimum,
what it might have been.
acknowledging it, right?
Yes. But knowing that agendas may be not what you think they are is an important learning for sure. Yeah, for sure. Well, on that note, Thank you. I mean, we go back to 1997 and a wedding of two of our mutual college friends. And I have been really, it's been such a gift to have you weave your way through my life over the course of my career. Disappear for a bit, see you at the Brigham, disappear for a bit, find you in a boardroom at Horizon when we came to pitch Able to, and couldn't even start, as you and I will both recall, without giving one another a hug, which I'm sure Bob Marino and the rest of the executive team were like, who are these people and what's going on? And being able to just call you on my entrepreneurial journey and say, how should I be thinking about equity? How should I think about this job? I mean, there were points where I was not happy and needed the advice of a friend and mentor. So grateful for you, and grateful to have you share your learnings with the rest of the world for the next generation of docs and clinicians coming up in the business world. So thank you so much.
Well, listen, thank you. I'm honored that you think worthy of me to have this conversation with you. I'm so proud of, if I can be, of returning the conversation, proud of everything you've accomplished. And more importantly, that you're taking this initiative to really help the next, generation of doctorpreneurs or clinical leaders, could be more than physicians, really make a mark on our industry. We need all the help we can get, and you're making a huge strides forward. So I thank you. Thank you for doing
that feels my next see one, do one, teach one calling, right? Having been there, done that, to take all those learnings and turn them around to help the next generation speed their path to success. I think businesses will be more successful if we have successful healthcare leaders with clinical expertise. So I think it's for the good of everybody, hopefully. So I appreciate it.
Keep going. Keep going. You got a fan in me. So
Love it. Thanks.